Over 1 billion people worldwide are currently managing a compounding physiological crisis known as metabolic syndrome. It's a cluster of conditions: central obesity, hypertension, high blood glucose, and dyslipidemia, operating together to degrade cardiovascular health. Standard clinical interventions typically rely heavily on a combination of lifelong systemic pharmaceuticals and notoriously difficult lifestyle modifications. But a peer-reviewed analysis in the International Journal of Health Sciences and Research details an alternative protocol. It's a traditional Ayurvedic procedure called Udwartana. Today, we are going to deconstruct this procedure to see exactly how sustained dry powder friction functions as a targeted mechanopharmacological intervention, one capable of physically breaking the metabolic syndrome cascade. This flowchart maps the systemic cascade of metabolic syndrome. To break it, we must find the foundational tissue layer where the disease originates. The pathology hinges on a single primary input: the accumulation of visceral obesity and the resulting over-secretion of free fatty acids. As the adipose tissue expands, it forces the systemic release of inflammatory cytokines, specifically IL-6 and TNF-alpha. These molecules circulate and directly trigger insulin resistance across the body. A truly curative intervention cannot simply manage downstream symptoms like high blood pressure or glucose levels. It must physically target and alter the subcutaneous adipose tissue itself. To see how this happens, we have to look inside the fat layer. As an individual adipocyte enlarges, it stops acting as a healthy storage cell and becomes a dysfunctional, toxic endocrine organ. This hypertrophic fat maintains a continuous release of free fatty acids and pro-inflammatory cytokines into the local bloodstream. These molecules travel to muscle tissue, where they block glucose absorption, and then to the liver, forcing the overproduction of very low-density lipoproteins. But as the subcutaneous fat layer thickens, a primary physical bottleneck forms. The local blood flow per unit weight drastically decreases. This localized ischemia creates a stagnant trap, choking off circulatory access and making it impossible to clear toxic lipids. This is where Udwartana enters the clinical picture, specifically a subtype called Udgarsha, which uses the application of dry powders without oils to mechanically interrupt this localized stagnation. The physical execution requires 30 to 45 minutes of firm, consistent upward strokes to generate a high degree of sustained friction on the skin. To work, this friction must be paired with the correct pharmacology. Practitioners use dry herbs known as Ruksha which possess necessary heat-generating and penetrating properties. The clinical literature cites specific powders like Kulatha and Trifala. These are chosen explicitly for their capacity to dissolve fat, a property referred to in the texts as meta-vilayana. The procedure combines severe mechanical stress with targeted topical pharmacology, designed to force a tissue-level physiological response. Ayurvedic texts describe this process as clearing obstruction, or avarod. In modern biological terms, we are looking at the precise mechanism of mechanotransduction. The constant surface friction of the dry powders forces intense, localized vasodilation of the cutaneous blood vessels. The local tissue temperature rises, and blood flow velocity accelerates. This directly overcomes the ischemic trap we identified earlier. With circulation restored, the mechanical stress provides a critical biochemical trigger: the physical stimulation of beta-3 adrenergic receptors embedded within the subcutaneous adipose tissue. This receptor activation actively cleaves the large, trapped triglycerides, breaking them apart into smaller, mobile, free fatty acids. The newly freed fatty acids mobilize out of the fat tissue and flush into the enhanced bloodstream, carried to the liver for clearance. By pairing abrasive pharmacology with sustained mechanical pressure, Udwartana successfully converts external friction into an internal biochemical cascade of lipolysis. The clinical data validates this biomechanical theory. Patients undergoing this protocol record measurable drops in physical parameters, including body weight, BMI, and skin fold thickness. This chart shows the concurrent biochemical outcomes. There is a distinct reduction in serum LDL lipids, paired directly with a rising trend line for HDL cholesterol. Together, these metrics prove the therapy successfully enhances lipolytic enzyme activity to clear systemic lipid burdens. The evidence confirms that a targeted, localized physical intervention produces a verifiable systemic biochemical correction. If we return to the pathology flowchart, we can see exactly how treating this root cause halts the entire syndrome. By directly mobilizing the visceral obesity node, the downstream complications, insulin resistance, hypertension, and dyslipidemia, are completely starved of their pathological fuel. Addressing complex systemic metabolic failure doesn't always require internal pharmaceuticals. Rigorous mechanopharmacological interventions like Udwartana offer a potent clinical tool for reversing biochemical stagnation.